So medical imaging is all of the imaging that happens in the hospital. So we have different imaging tools to allow us to see into the body: X-ray, CT scanning, ultrasound, MRI, and pretty much any disease you can think of. It has some kind of physical, visual manifestation that we can see. So when I started in 2005, I was the 6th radiologist here. So we're moving towards tripling the size of the department since then, definitely double since Jim Pattison opened. But that's just the radiologist. We're just one part of the department. We have imaging technologists in all of those separate areas that I talked about, and they're specialized to those areas. And then we have nurses, and we have other assistants as well. When Jim Pattison opened, it had a couple of big focuses that we wanted to stress for medical imaging. And one of them really is where we are here, is the breast health clinic. It was sort of envisioned as a state-of-the-art multidisciplinary clinic. The patient would come in who had some kind of breast issue, would get seen by a surgeon, would then go and get all of the imaging that she would need. So whether it was a mammogram, an ultrasound, and then the technologist would come and review all of that with me, and then I would make my recommendations. So that might be that the lady needs a biopsy. So in that case, we would do the biopsy the same day. So you came, you got a diagnosis, all in the same day. And we have the ability to do MRI guided biopsies here, which is only done in 2 sites in Fraser and only a handful of sites in the Lower Mainland. Anything related to MRI has really developed. So as our ability to image in more detail has increased, then that has changed our field. So we're able to detect very, very small cancers that were harder to see a decade or 2 decades ago because of the limitations of the technology. Other areas like cardiac imaging has really advanced over the period that Jim Pattison has been around, and we've started a new cardiac program here where we do MRI imaging of the heart in motion to assess problems that radiologists weren't able to diagnose previously. What a lot of people don't realize is that there's 2 areas to radiology. One is diagnostic and one is interventional radiology. And what that means is we take the ability to see inside the body, and we use it to help guide us with minimally invasive surgeries where we can take a wire or a catheter and watch as it goes into the body and get to a precise place inside the body where we can then perform an intervention. We service such a large community. We feel so much more satisfied to know that they're getting the best care that is available and truly the gold standard in all of these areas, and that Surrey is not left behind, and really we can actually lead the way and be doing the best we can for our patients.